Hi, I'm Dr. Natalie Marks, and I'm here with a Fountain Report conversation. Joining us today is Dr. Dan Markwalder. Dan, thanks for being here.
Thanks for having me.
As one of the thought leaders in our profession, we're really interested in hearing a little bit more about what trends and innovations and companies you're following right now.
I think first, it's technology. How are you embracing technology first and foremost to make your hospital more efficient? Maybe that's going to be through AI dictation. Second would be how are you making your hospital more convenient for the patients and clients that you serve? Are you using things like online pharmacies? Are you using modalities like online appointment scheduling? I think the other trend that I'm looking at is how do you adapt to what's going to be coming down the road, and that is this aging pet population. Some suggest that we're going to have a increase in the number of geriatric and senior patient. How are you now building a moat around your hospital to prepare for that upcoming aging pet population?
So let's stay there for a minute. So that to me, not only does that create the issue of what type of medicine are you practicing? What are you offering to sustain the quality and quantity of life for those geriatric and senior pets? But that also may mean that you have a varying client demographic as well, right?
Sure.
So what kind of guidance are you giving to associates and some of the different hospitals that you're mentoring to work on this moat?
Sure. I think you have to really know your client base. I'm an older practitioner where it was fairly monolithic when I started in the profession close to over 3 decades ago. Today, you don't have to be all things to all clients. Get really good at doing a few things well. So if you're serving predominantly a millennial generation or a Gen Z, that may look different in your practice than maybe a practice that I might have at Naples, Florida. So get really good to know your client base and what are the things that matter to them. If I have a practice in the city, maybe online booking is going to be the way to go. And I'm going to make sure that I embrace technology that allows me to have that one-on-one customized interaction with that client. So first, know your client base. Second, communicate that to the team. What does that look like in your hospital? What is that individualized, customized care that we hear so much about? What does that look like in your certain demographic region? And then I think third, it's leadership. You as the leader of your practice, what are you doing to really inoculate your hospital for the patients that you serve? Because we know that there are so many other quote unquote competitors. And I'm not just talking about veterinary competitors. I'm talking about
Mhm.
that share of the wallet, right? Every time that I'm spending money outside of that veterinary clinic, that's less money for the clinic. So what are you doing to engage that client? How are you leading that practice? Not only 6 months down the road, 1 year down the road, 3 years down the road, 5 years down the road. Get really good as a leader of your practice, have an insatiable appetite of really being the visionary leader. And that means looking proactively, what are the things that are coming into the market that's going to help you become competitive?
I want to get a little granular and foundational on some of the things you said, and I wanted to start with knowing your client base. So if you're a graduating student, a new entrepreneur, you're wanting to start your own practice, for those that may not know, how do they know their client base, right? What are the resources that they can pull from, or where can they look to really kind of get deep in the weeds of what that demographic is, or how, even more importantly, when they establish, how do you create the client base you want?
Natalie, here's what's the exciting, really the exciting part of veterinary medicine today. When you and I started our first practices, let's face it, we didn't have the data analytics
Right.
that we have today. There are companies that literally go in there and can do data analysis of the demographics in your geographical area. If I was starting a practice today, one of the first things I would do is have one of these third-party platforms take a look at the demographics that I'm going to serve. Why is that important? My mission, my vision, my core values are going to be commensurate with that demographic that I'm going to serve. So for me, first and foremost, get the data. But one first step is getting the data. Second, interpret that data.
Mhm.
How is that going to allow me to interact with that client base so that I'm not a monolithic practice? You have to differentiate yourself in the
Mhm.
competitive environment that we're today. Don't necessarily just do what the person down the street is doing. What's your competitive edge and how are you differentiating yourself today?
And I think I would add to that is you have to let your clients know that you are,
That's right.
right? And I think one of the things that some of the younger practice owners and even some established practice fail to value sometimes is truly targeted marketing.
Absolutely.
What do you think about that strategy? What do you encourage young owners to do when we think about even SEO targeting and their marketing strategy?
That's right. We know, for instance, Google rating is absolutely critical. So what do I mean by that? If you have a Google rating of, say, 4.8, don't necessarily try to achieve to a 5.0. If your competitors are around a 4.6, we know that in the demographic market of your veterinary hospital, if you are best in class from a Google rating, you grow on average 50% faster than practices that are lower. So part of that is you've got to learn the power of marketing. That's absolutely online marketing. Again, when I was a young practitioner, it was all about the yellow pages. What I love today about the next generation of practice owners, they embrace the digital marketing. Get to know the needs of your clients, find what their pain point may be, if it's convenience or pet drop off, whatever it may be. Maybe it's extended hours, convenient care, urgent care, whatever it may be, and then target market to that specific needs of that client. That's going to allow you to have that competitive edge.
So putting that all together, how do we apply that to that growing need of the senior and geriatric pets?
So I think it's important as we see uptick in that senior. As a general practitioner, what are you doing to meet the needs of that patient and that client today? That holistic, what I call that ecosystem.
Mm-hmm.
That patient who may be less active. How are you interacting and dialoguing with that client? Maybe they're eating less. And so I think you have to have a very active communication portal, and that has to be well developed and ongoing. Here's the good news, Natalie. We know, and it doesn't matter the generation, the veterinarian, the local veterinarian is still considered the number one
Mm-hmm.
most trusted expert. But let's face it, we don't do a good job communicating that.
Right.
Everybody else does. And how are you going to communicate that and educate? Why is that important? Because we know that the educated client is more compliant. Meeting that client where they're at, but always taking them to that next level. And so you've got to develop within the four walls of your hospital an ecosystem to say, here's the coming needs of the senior geriatric pet, and here's what we do well. So it may be become an expert on pet nutrition. Train up your team members on pet nutrition. Train up your team members that they can talk about pet obesity. They could talk about the common diseases that we see. How do we prevent disease? It's an ecosystem, and you've got to meet that client where they're at.
That sounds, in theory, wonderful. In reality, someone listening might be like, there's so much to do, right? Where do I start? Where do I begin? How do I find the time? We know we have to find the time. I think this is where innovation can come in, right? To help supplement as a resource some of these strategies and implementations that you can't do it all yourself.
That's
So,
right.
what are you looking at from an innovative perspective, to help these hospitals differentiate or build the moat or communicate better, or all of the above, because the single practice owner is not going to be able to do it all
You're right.
themselves, right?
And the good and the bad in today's world is this: we have a plethora of all this technology coming on board in veterinary medicine. That's exciting. Just think of what ChatGPT can do for us, right? We used to talk about, we would Google all the different wants and needs for our pet, and now we have ChatGPT, and there's good and bad. I think first and foremost, you have to educate yourself. You don't necessarily need every piece of technology in your practice today. Get good at one or two things that can, again, give you that competitive edge. So I think first and foremost, educate yourself. Attend conferences, read the journals. Education is the key for you. Second, rely on your team members.
Mm-hmm.
You have team members that probably are very adept at technology. What are the things that they can come alongside and help you as a practice owner take your practice to the next level? Don't try to bring all the technology on at the same time.
Mm-hmm.
Maybe commit yourself to one or two things each year and then improve upon that.
With that, you mentioned team. And I think one of the challenges that a lot of hospitals today, whether they're a one doctor practice or a large corporation, is having is retention, right, of the team. And also, I think also finding time to train the team.
Yep.
You know, there might be the one onboarding, but we're not doing staff meetings anymore. We're really kind of plateaued. How do you educate your mentees and the doctors that you work with on that? And how do we best retain our employees and our colleagues so that they're empowered at their highest skill set?
So, Bain and Company has done the research. We know in a time of transformation, well, let's face it, in veterinary medicine today, we're undergoing a significant amount
Yes.
of change.
Yes.
We know this, companies that are really good at attracting, retaining, and developing talent, they do much better. So how do you do it is always the $64,000 question.
Right.
And the key pillars is this: you've got to have a development platform within your hospital. One of the metrics that I used when I was a practice owner, at any given time, I wanted to see 25% of my team members in some sort of active educational program. That may mean that you've got veterinary assistants that are going to school and getting their technician degree.
Mm-hmm.
You may have veterinarians that want to have an interest in improving their surgical skills or dental skills. So you've got to have an ecosystem again that allows for every team member to first and foremost have goals, educational and development, professional goals. Two, that you are a good steward and allowing them, giving them the opportunity to improve upon their skill sets. We have to be a good steward of those individuals. The good news is that the research has been done. AHA has done the research. We know that organizations that have high retention rates, they have an active educational development program within the four walls of their hospital.
Mm-hmm.
It starts with having team members that are mentoring other team members. The
Mm-hmm.
nice thing about veterinary medicine is we have this diversity within the four walls of our hospitals. Think about that. We have everything from new high school graduates to highly educated individuals. And when I talk about mentorship, where we're coming alongside and giving the skill sets, both the clinical and the non-clinical skills, it's not just for new graduates. Is that important? Absolutely. But everybody in that practice should be participating in mentorship.
Yeah, and I think one of the things I didn't learn right away is the power of reverse mentorship,
That's right.
right? And I really embraced it as I went through my practice ownership, and I think we can learn so much both sides, right? Final thing, we only have a few more minutes left. I wanted to ask you, Dan, is if there was one technology company you're following right now, or one thing where you're like, this is really the future of veterinary medicine, or even just a category, what would it be?
For me right now, because I hire a lot of new graduate veterinarians, I'm deeply concerned about issues like lack of mental well-being, burnout today. And I have a theory that veterinarians that are getting burned out, it's not just from their caseload. First and foremost, it's doing things that they should not be doing as veterinarians. One of the things that we did in our organization is we brought in a AI medical dictation service. We've done well over 1 million medical transcribed notes, and it's made a difference on the average, saving our local practitioner 3 to 5 minutes per patient. Now, extrapolate that over a day, a month, a year. It breaks my heart when I see young veterinarians that are staying 1, 2, 3 hours each and every night doing their medical notations. And I think we're just starting to scratch the surface of that. And I'm very, very excited about that.
Yeah, I remember those long nights. I think we both had those. So it's so happy to hear that the wave of the future is that is unacceptable anymore. Dan, really appreciate your insights. Hope you'll join us again.
You bet. Thank you, Natalie.